The next topic in developmental disturbances of jaws is MACROGNATHIA, which means abnormally large jaws. Hi, welcome to DentoRise. Macro means large and gnathia means jaws. MACROGNATHIA means abnormally large jaws. Now, these abnormally large jaws can be actual increase in the size of the jaws, or it can be because of disparity in the size or position of the jaws with respect to each other. Talking first of all about the actual increase in the size of the jaws. The jaws can increase in size because of certain conditions. The first condition is pituitary gigantism, wherein there is an overall increase in the size of the body, and thus increase in the jaw size is proportional to the increase in the body size. The second condition is Paget's disease of the bone, wherein there is an overgrowth or increase in the size of both the maxilla as well as the mandible. Third is acromegaly, wherein hyperpituitarism leads to overgrowth of the mandible. The fourth condition is leontiasis osseosa, which is a form of fibrous dysplasia which leads to enlargement of the maxilla. Now, among the mandible and the maxilla, mandible is more commonly affected because of MACROGNATHIA as compared to the maxilla. The reasons for these are, number one, it can be because of the small size of the maxilla, which gives an impression of mandible being large in size. Number two, it can be because of the posterior position of the maxilla with respect to the mandible, which gives an impression of mandibular prognatism. Mandibular prognatism means the mandible is positioned forwardly in comparison to the maxilla. Also, number three, because of excessive growth of the condyle, the mandible may become prognathic. So, the features of mandibular prognatism which gives an impression of MACROGNATHIA of the mandible is, there is an increase in the height of ramus of the mandible, there is an increase in the size of body of the mandible, there is increase in the gonial angle. The mandible can be positioned anteriorly in the glenoid fossa. The other factors are prominent chin button, varying soft tissue contours, etc. The treatment for mandibular MACROGNATHIA is surgical, that is ostectomy, which gives beautiful functional and cosmetic results. This was all about MACROGNATHIA. Stay tuned for more such videos on oral pathology. Do like, share and subscribe.